This was my son, Steve. Steve was 58. He died from the virus. I went in the hospital first, and he come in after me about 5 days. We lived together. He was my caregiver. When I got home, the VNA came. Thank God, because I would have been alone.
I think looking back on the past year, there's a lot to be proud of at VNA Health Group. The way that we've handled the COVID-19 pandemic, stepping up and helping so many people, serving over 1,500 people with active COVID-19 infection, and doing that while keeping our staff safe.
That weekend in March, which we'll never forget, I had seen Dr. Landers in the hall, and he said to me, everything is going to be shut down, get the teams ready. It came that fast and furious, but thanks to our CEO and other physician leaders to have the foresight to see this and follow the numbers, we really were ready ahead of most others.
Our caregiving teams, nurses, therapists, social workers, community health workers, doctors, stepped up to help people in a real scary time.
Helping patients in this pandemic is a little bit scary and overwhelming, especially to us healthcare workers. When you see that your patients are recovering from this illness, it makes you wanna help the other people more.
We had 2 nurses in full PPE from head to toe. First nurse being called the isolation nurse, which delivered the hands-on care. So she would go to the door, take care of all of the needs of the patient, and then basically dictate pieces of the chart that needed to go into our electronic medical record, and the other nurse would be nearby in the car.
It's been crazy. A lot of patients are getting discharged, they're scared. It makes me feel good that I'm able to bring them some assurance that I am following them every day. Personally, I had to have my 18-month-old daughter go to my parents, and I miss her so much, but I know it's the right thing to do. This has been extremely rewarding and extremely trying and extremely scary.
I'm very proud of them. This truly was personal sacrifices for many. We have partners, hospital partners all over the state, which are extremely important to us. As we heard that their emergency room departments were becoming overloaded, we stepped up very quickly. I'm proud to say our outcomes were very good. Very few patients ended up back in the hospital, and very, very low mortality rates.
I really felt awful, and so we went to the emergency room.
Our VNA nurse, Michelle, became our lifeline.
I come home from the hospital really feeling down, and she picked up my spirits and focused me on getting well again.
We've just seen so many examples of sacrifice, of courage, of people stepping up in order to help people in need.
At the end of the day, we're all doing it for our community, just to have a safer community for everybody.
The CHC family really has come together as a whole to get through the pandemic, to keep our services open, and really to put themselves on the front lines of this deadly virus.
Usually this Children and Family Health Institute hub is just a very busy place with people coming in and out, grabbing supplies, going out to people's homes, going out to community meetings. We were able to really pivot and change this location into the hub of our COVID testing.
We were the first federally qualified health center in the country to launch saliva testing. It was a game changer for us.
The biggest way that we stepped up as an organization and within the Advanced Care Institute is to recognize we're caring for the most vulnerable population, whether it's the hospice population, the palliative population, or the visiting physicians. And how can we best think on our feet and pivot as the wind changed? Other clinicians really started to understand the value of palliative care, hospice care, and what can be brought to the bedside. The wave, the enormity of the numbers of having these conversations and seeing these patients and talking to these families was at times crushing.
All I wanted to do was to be with him. He was about right around the corner from me, and I couldn't get to him. It was awful, awful. And it still haunts me.
There's just no words. There's no words for how you help somebody and hold their hand and walk them through those that just, incredibly difficult time.
We've had over 50 different publications in the media highlighting the work of our team during this past year. One of the great pieces of recognition that our frontline nurses received was actually being featured on Good Morning America.
This time we're talking about visiting nurses. They're outside the hospital and they're taking on COVID-19 with courage and compassion.
We're now seeing more the public, the media, the political world start to pay more and more attention to the importance of home and community-based care.
Good morning, Chairman Collins, Ranking Member Casey, members of
I
the
was
Senate.
invited to testify in front of the United States Senate about how to improve home and community care for older adults. So we're seeing that interest, and I think that that's going to lead to more and more opportunity.
People are undergoing so many different types of stresses, whether those are health stresses or economic stresses, and that is what the VNA is here for.
Hi everybody, welcome to Quarantune.
Whether that's, gathering parents via Zoom, whether that is equipping our nurses with the masks and other equipment that they need, whether it's getting that mobile HIV van back out there.
Our patients didn't waver either. They continued their trust in us. They continued access to care, whether it was through telehealth or coming into the health center.
People are more isolated than they've been before. Economically, people are struggling much more than they've been before. They're having a hard time paying the bills. And so it's been really important that we be there for them. One of the ways that we've been able to alleviate that is to bring gift certificates for places like grocery stores and department stores.
One of the things that's been most impressive is seeing our teams pull together and help one another. And probably the greatest example of that is through our We Care initiatives and our Employee Emergency Response Fund. Our team members have donated hundreds of thousands of dollars in paid time off and personal donations to support one another.
I've never realized how much a community nurse can make an impact as we are right now.
It has been a tremendous honor and frankly a humbling experience to work amidst greatness, to work amidst the dedication and the professionalism of our team members. Every day I come into work, I'm in awe of them.
It was just so empowering and so uplifting to be part of a group that walked into the fire and was willing to walk into the fire for the greater good of the community.
This really has been an extraordinary time to be part of the VNA. I mean, this organization has deep, deep roots in meeting the emerging needs of the community.
The effort, the bravery, the courage, our teams have just been true heroes.
I would like to tell Frances that I love her. I'd love to hug her. You're very special, Frances. You really are.
To all of the nurses who are so courageous in going out to houses during this most difficult time,
Really thank you from
beyond
the bottom of our
grateful.
heart.
We are beyond grateful.
Really feel beholden to you.
They are just heroes. I have the chills just talking about it.